The Shadow Minister for Health and Ageing, Mark Butler. Thanks very much for your time.
Morning, Kieran.
Can I start with a broad question? You've been critical of the government on various responses to COVID. What would you and Labor have done differently?
Well, we'd have negotiated more deals. We were saying that last year, that there simply weren't enough deals being negotiated by the government with the vaccine companies, and we'd have negotiated them earlier. There are very credible reports that Pfizer approached the government as early as June last year for Australia to be one of the first countries to get access to their highly effective mRNA vaccine, and that those talks broke down because of some, from their perspective, pretty hardline demands from the Australian government about what it would take to get a deal. So Pfizer, unsurprisingly perhaps, went to Israel, went to the US, went to the UK. They struck deals in July to get access to those vaccines. We didn't get a deal until November, which meant we were very late getting Pfizer. And the government has also been, until very recently, quite dismissive of our calls for months and months to do a deal with Moderna. Now, the reason why you would have so many different vaccines is no one could have predicted what's happened with AstraZeneca, but it is always likely in the sort of emergency we're experiencing around the world that unforeseen events arise and you need to take out insurance when they do arise. And this government simply hasn't done enough of that.
So it's not just about saying we should have had more Pfizer earlier. You're saying as well the government didn't spread its bets, essentially.
Right. We were saying last year when Chris Bowen was the Shadow Health Minister, you need to do 5 or 6 deals. That was recognised by experts as the best practice approach to this. That's what other countries were doing. So when they ran into trouble with a particular vaccine around supply or around potential adverse events like we've seen reported with AstraZeneca, there were other deals to fall back on. And Australia just hasn't had enough of that. We're really left only now with Pfizer for a broad population vaccine, which is only coming in at about 350,000 doses a week.
Moderna is also on order, though, isn't it now?
Well, Moderna still hasn't, yes, it's on order, but it hasn't been approved yet by the TGA. I'm pretty confident it will be, obviously. It's operating in dozens of countries around the world, a highly effective vaccine, but we won't see it until very late this year. We should be substituting it right now for AstraZeneca, which is what other countries around the world have been able to do.
With AstraZeneca, it is a minuscule risk, isn't it? Are our health authorities being too cautious?
Well, I don't think it's a good idea for politicians to second-guess public health advice. I think the thing that has served us very well in this country, frankly in contrast to some countries to which we usually compare ourselves, is there is no political debate about the public health advice. State, federal governments, Labor and Liberal alike, with 1 or 2 individual exceptions, broadly have followed the public health advice to the letter, and that has served us very well.
But it's still a good vaccine, isn't it?
Well, it's a highly effective vaccine. It does have this particular side effect, which appears to be more pronounced for younger people, which is why there's that age cut-off, not just here in Australia, but in countries around the world. There is
and the risk profile also shifts, doesn't it? Because if the older you get, when you're over 60 and beyond 70, even more so, the COVID risk is significant.
Much more pronounced, that's right. So it's much more pronounced for older people, but also the risk of this thrombosis with thrombocytopenia syndrome, the clotting with low platelets, is far less of a risk for older people. So, it's really a two-way thing that shows that for older people, taking AstraZeneca is still a very safe and effective option.
Do you think we might see the reverse of this is that in some ways it might be a bonus because it says to those in their 50s who might have been hesitant that, OK, you can go get the Pfizer now. We might see hundreds of thousands more go and get the jab as a result now.
Well, I'd like to think that would be the case. There are still about 815,000 people who've taken, in their 50s, who've had 1 dose of AstraZeneca and who are now ringing their GPs. We know this through the reports we've seen over the last couple of days. Asking people at state-run vaccine clinics, what do I do about the second dose? There's a lot of confusion, understandably, out in the community about what this means for almost 1 million people in their 50s who've had a single dose of Astra and are due to have a second dose sometime in the future. Now, public health advice has been go and get your second dose. I'm one of those people. I'll be going to get my second dose.
Well, it's even smaller, the risk.
It's a very minuscule risk for a second dose. So when this syndrome, the TTS syndrome, does emerge, in those very, very rare cases, it tends to emerge around the first dose. So if you've had your first dose the public health advice is go and get your second dose. I'll certainly be doing that, but there is a lot of confusion. This will, I think, be a further break on a vaccine rollout that is already desperately behind schedule. This vaccine rollout, have no doubt, is in deep trouble. It's in deep trouble.
Have we been victims of our success in a way? Because, as Andrew Clennell mentioned, 60% of adult population in the UK fully vaccinated, largely with AstraZeneca, we should mention as well, but because they've had such a shocking experience with COVID. Here, obviously, we had the terrible lockdown in Victoria and hundreds of deaths still, but nothing like we've seen internationally. Have we been victims of our success in that sense? It's led to complacency.
Sure. State governments, the Australian people have responded magnificently to the COVID threat. And as a result, although we've seen some real tragedies, particularly in Victoria, you would not really want to live in any other country on the face of the planet than Australia. But the government knew that, and the government should have crafted a public health information campaign understanding that you weren't going to see the sorts of crisis and emergency that you've seen in so many Northern Hemisphere countries that would drive people to go out and get vaccinated to protect themselves. The risk-benefit equation for Australians is very different. That's why we've been so critical of the government's failure to put in place a strong, targeted public health campaign. You see them all around the world. We've got a wonderful tradition of that here in Australia, highly effective campaigns. But the government's rolled out really next to nothing. And what they have rolled out, frankly, it is regarded, I think, by all of the advertising experts and behavioural psychologists as pretty weak. So yes, you're right. There's a very different environment we face here in Australia than the Northern Hemisphere because the Australian people have responded so well to the threat over the last 15 months. But we knew that. And the government should have understood that and put in place a strong public health campaign.
These outbreaks, though, there might be a silver lining to them, as we touched on earlier, because it says to people, look, get out there and get the jab if you want to return to some normality.
Well, have no doubt we're still way behind in vaccines. We're still only a bit over 6 million doses around the world. It's 2.5 billion. The UK at 72, and the US it's more than 310 million doses. We're still only 3% fully vaccinated, but the numbers did lift as soon as the Victorian cluster emerged. Most of those numbers are coming from Victoria. Victoria's had more vaccines than New South Wales, a substantially bigger state. But you're right, we did see an uptick after the Victorian cluster, but we're still nowhere near the rate of vaccinations we need to be if we're going to vaccinate the population around the end of the year. And we need to do that with the current generation of vaccines because we know with these variants, the fact the virus is mutating, we will almost certainly need booster shots.
Do you like the idea of a red light, green light system, as the Prime Minister touched on with Andrew Clennell in that interview in the UK? He's talking about a red light, green light system where those from safer countries that can show that they've been vaccinated, show the documents that they can have less quarantine upon arrival when we've eventually reopened.
I think the Prime Minister has been sending too many mixed messages about this. Several weeks ago he said that we could have travel overseas as early as July and maybe we'd be allowed to quarantine at home, and then he walked back from that and now he's talking about red light, green light, orange light systems. I would prefer he concentrated on his two jobs. And his two jobs are to roll out the vaccine in a speedy and effective way, and we're still only at 3% full vaccination in Australia, and put in place a safe national quarantine system. And I don't think the Australian people are ready to talk about these sorts of travel systems until they have confidence that the Prime Minister has achieved those two jobs. We don't have an effective quarantine system. We still rely on hotel quarantine far too much, which continues to leak or see outbreaks every week or two. And we're way behind on vaccines. At some point, yes, let's have that discussion. But the Prime Minister keeps sort of raising these thought bubbles without, I think, indicating to the Australian people his eyes are focused on those two jobs.
He's made it pretty clear that those quarantine facilities outside of hotels are coming. We know there's the deal with Victoria, but others likely. And he said that there needs to be a focus on immigration workforce to expand that. So that's clearly the direction he's heading.
Well, it's incredibly slow. I mean, I'd say Christmas is coming, but Christmas is going to come before any purpose-built quarantine facility. We were supposed to have Howard Springs in the Territory expanded to 2,000 places by April or May, the Prime Minister said, from 800 to 2,000 places. It's still not operating at 2,000 places. We're into late June.
But there's a workforce issue, as
there's a workforce issue, of course, but the Prime Minister should have foreseen that. He should have been able to deal with that. We have a memorandum of understanding for a facility in Victoria that on best estimates would not be operating until 2022. The Prime Minister had recommendations about these sorts of things in October last year. We're not going to see a facility until 2022.
Do you think it's fair for the government to start focusing more on hospitalisation numbers as opposed to simply case numbers to show that the vaccines are working, to say, look, there is not serious illness once you've got vaccinated?
I think we should focus on all of those indicators. We need to know how many infections there are in the country. We know that these variants, particularly the Delta variant that is becoming the dominant variant around the world, according to a report from the World Health Organization only in the last 24 hours, is highly infectious. It's become the dominant strain very, very quickly because it's able to overwhelm the other strains. And it's also potentially a strain that is resistant to some of the vaccines in a way that other strains aren't as well.
Is that what you're talking about in terms of the boosters and that sort of thing?
That's right. That's why the vaccine companies and health authorities are saying we're going to need boosters. The UK has been looking at boosters as soon as September, October. Now, we're not going to be even close to getting the current generation of vaccines into the Australian people before we start to look at boosters.
With this Delta variant, we saw the outbreak in Sydney at the moment, a small cluster. Are we going to see a real-life comparison between the more open approach of Gladys Berejiklian versus the Victorian government, which, preferred the lockdown model as we saw recently?
Well, I'm hopeful that we get on top of the Bondi cluster or the Sydney cluster very quickly. But I think everyone's concerned, though, that the last 4 cases, I think, that have emerged over the last few days have been very fleeting contacts. So people really who've not had any known contact with each other, just happened to be in the same shopping centre at Bondi Junction, appear to have picked up the infection. That shows you how infectious, how transmissible this particular strain is, and why we have to be on our guard. We have to remain vigilant, get vaccinated as quickly as possible, and recognise we need more purpose-built quarantine than continuing to rely on hotels, the hotels that were built for tourism,
and lots of tests as well, obviously.
Lots of tests.
Yeah. Mark Butler, I appreciate your time. Shadow Health Minister Mark Butler, thanks.
Thanks, Kieran.
Take care.